Hello, welcome to my channel. My name is Bridget. I'm a nurse practitioner. Today I'll be going over 5 fundamentals or foundations NCLEX questions with their answers, courtesy of nursing.com. Let me know if you prefer. I've done a few NCLEX videos without me, like without this picture-in-picture. Let me know if you prefer like no video, with video. Drop a comment below. Also, drop a comment below. What subject would you like me to cover? You want me to do more cardiac, pharmacology, mental health, etc. Before we get started, I just want to let you know that nursing.com, between August 16th through 24, they are offering a huge back to school promo. And so between August 16 and August 24, nursing.com is offering 40% off their 2-year plan. And in addition, anyone that starts a 2-year membership, they will be shipped a book bundle that is a total saving of about $300. And the books include 140 must-know meds, 63 must-know lab values, nursing mnemonics, and the second edition NCLEX review book. A nurse walks into the dirty utility area of the unit and finds a small fire burning in the corner. The nurse is able to quickly put it out with a nearby fire extinguisher before it activates the fire alarm. Which of the following should be the next step of the nurse? So think of the priority here, and the priority is to let the fire department know what happened. So a small fire, whether or not it activates the fire alarm, should be reported to the fire department if it occurs in a healthcare facility. It's foul play happened here, right? A small fire burning in the corner. So this is potentially a crime scene. So we don't want to contaminate that crime scene. A nurse utilizes critical thinking skills while providing care on the medical surgical floor, which best describes a true statement regarding use of critical thinking skills. Critical thinking makes the best use of a nurse's time. Critical thinking involves analyzing the information at hand. Critical thinking involves considering putting tasks in order of importance, and critical thinking is the process by which a course of action is determined. Critical thinking involves analyzing. This is why you don't want to overthink on the NCLEX. Like, I could potentially talk myself into the other answers, but at the end of the day, critical thinking involves analysis. So that was the best answer. A client who has been injured in a car accident is suffering from sleep difficulties because of the pain. Which of the following describes how pain impacts a person's ability to gain adequate sleep? Pain doesn't cause more antidiuretic hormone. So pain can wake a person up at night, and sleep deprivation can worsen pain. So it becomes a vicious cycle. Pain and sleep have a negative relationship, and they each affect the other, and it sometimes is unknown which causes the other. A person who is in pain may suffer from sleep deprivation, and lack of sleep can make pain symptoms worse. A student nurse asks the instructor when an electroencephalography is needed, EEG. That's what neurologists will put on someone that has had a seizure to analyze their brain activity. The instructor would be correct in saying that an EEG is needed at which of the following times? Select all that apply. When seizure activity is suspected to confirm suspected neurological disorder. When there is head trauma before and after ECT, you don't need an EEG to diagnose a psych disorder. So an EEG watches brainwaves, so it is done before and after ECT, electroconvulsive therapy, to identify effectiveness. And this is a lot of times will be used to see if they believe that this person has suffered a seizure. Psych disorders are diagnosed based on symptoms, not an EEG. The nurse knows that a client suffering from complete paralysis from the waist down would have the condition of which of the following? Hemi means half. Right? It's important to know your prefixes. So this one, it's paraplegia. Paraplegia. Now, test-taking strategy, right? A lot of times, the correct answer will have a similar one. So like, hemiparesis, hemiplegia. You know it's going to either be like paraplegia, paraparesis, or hemiparesis, hemiplegia. If you knew that you could eliminate hemi based on the prefix, you eliminate these, you have a 50-50 chance of getting this right. And then if you're not sure, then it was paraplegia, you would have that 50-50. I do have my own course on NCLEX test taking strategies. If you are interested, it's also in the description below. And that course covers basically test taking. It's not an NCLEX review book course. It's just test taking strategies that could help you get better scores on your tests. But anyways, so Paraparesis is partial paralysis, whereas paraplegia is complete paralysis. So para refers to the lower half of the body and plesia refers to complete paralysis, whereas hemiparesis refers to weakness or partial paralysis. The other thing that I forgot to mention is if you miss questions, there's always a video that accompanies that you can review as to why you missed that question, and you do get a breakdown of what questions you got right, how you did on your quiz. Thank you so much for watching. Make sure you hit the like button, make sure you subscribe, make sure you turn on that notification bell. It helps me out tremendously. Until next time.